Maayong buntag. Ay, ay, ay. Good morning, everyone. It's a blessing to be here. What a privilege. What a beautiful experience. It's a blessing to be together with David and Becky also. Many years we haven't seen each other. And also to see the faces of many of the other missionaries that we haven't seen in a long time. Also meeting new people, people that I have met in the messenger and the WhatsApp. Now we can see each other. What a blessing. All right, time is running, so we need to go. Battles of faith today will be the topic on natural remedies. So for natural remedies, I will give you some updates on what the Lord has been impressing me and what He has been teaching me about the treatments of diseases. So I will give you pieces and pieces of things that I will share with you as God has given it to me. So the number one thing is malaria. Malaria, I thought I could do it. I felt so confident. It's so easy until May 2022. You know, I had cases of malaria 3 days. They are feeling good already. 1 week and they are out of any symptoms. But this case was 1 month and a half. I thought I was losing a patient. And guess what? It is one of the worst cases of malaria, and it had to be my daughter. Oh, I was feeling so bad. You can imagine. So much success for many patients, and yet my own is not. So praying and praying, working together with my family, we started searching for more information, learning more, because that's what the problem is. Sometimes we don't have enough knowledge, right? So I started gathering more information, and we found some of the things that will be helpful for you, so I'll be sharing. So we spent a month and a half doing many things. She was actually complicated because as we went to Puerto to get some laboratories, she actually got dengue plus malaria. And we found out that she actually had 2 more infections. She had 2 parasitic infections, Giardia lamblia and also blastocystis hominis. I assume because she had rabbits at home, and maybe she was not careful with those things. So I'm assuming that's where the source was for the parasites. But, complicated because it was a very high load of Plasmodium vivax. I have the labs, actually. I have the picture. Well, I lost the picture, but I should have the labs in my house because we took several days the loads of the Plasmodium vivax, and it was really, really high. People actually in Adventist hospital in Palawan thought that she was going to die. But anyway, what to do? What do we do, and what would I will advise you? Number 1, remember that the chilling of the patients is very key in malaria. When you see someone that is chilling, think about malaria, right? And meaning the person has no fever during the day, maybe at 6 p.m. he starts chilling, and then the fever comes. And every day is almost the same. It's like a scheduled thing, a cycling thing. If you see that characteristic, you must think about malaria right away, because it may be malaria. Anyway, even if it's not, the best thing to do, number 1 is stop all sugars. That's what you need to do first in any infection. You stop all sugars, even honey, yes, stop them all. Don't worry about sugar for a few days until you can fight whatever is coming. Sugar lowers immune system, so you will not be able to fight any diseases, any infections, especially those and parasites also. Remember, malaria is a parasite. So you identify the time of the fever. So let's say it's around 6 p.m., no problem. Then you know that few minutes 6 p.m., before 6 p.m., you must start with wet sheet pack. Wet sheet pack as long as the patient is strong enough to endure it. With my daughter, we did actually 2 wet sheet packs a day for us to be able to keep her running. Whenever she was weak, then we did something to make her strong, and we did not do wet sheet pack. I will talk about that later when I focus more about wet sheet pack. But for now, this is what I can tell you. And then use pomelo, suha, lukban, grapefruit seeds, however you call it. But it is key. One of the reasons we were able to succeed by God's grace is because we found, oh yes, we still have some of the GSE, the grapefruit seed extract from the US. We kept it there. So we started dehydrating the seeds of the pomelo, for further use. And that's one thing I advise you as medical missionaries also. If you want to keep something handy, dehydrate pomelo seeds and keep them well where they cannot get any mold or anything for the time that you need it. So when you get suha, don't throw the seeds. Wash them well, dry them in the sun, pack them well, and keep them when you need, you have them. You want to get some business and do some grapefruit seeds extract also, you can do it. Anyway, grapefruit seed is very good for preserving when making tofu also. It's a good preservative because it kills bacteria. That's one of the reasons it's used also for this. It's so bitter, malaria parasites cannot stand it. It has to go away. So it is very key for the success of malaria. Other things, you have to consider if the person is not strong enough, you can do wet rather than, or dry rather than wet. How is that? Well, I will explain later how is a wet sheet pack and all that, but the dry wet sheet pack, basically you don't wrap the patient with a wet cloth. Just wrap them with plastic or a blanket and then plastic, whatever form you can do it, but only dry, not wet. That form, the person is able to, the presentation was not running well. Well, anyway, that way the person will not lose so much electrolytes and will feel better and will be able to stand more. Because we need to be careful with the electrolytes balance of the person. And if a person loses sodium too much, they go in a hyponatremia, and then that will lead into more problems. So we have to be very careful with that. Then the other one is what to do to make the person strong, either in one day or a few minutes, hours maybe. The best things to do is, the simplest is calamansi juice with water. That is not so strong, that's kind of mild. It gives the person some strength, but not too much. But it is very quick. In a few minutes, you feel really good. Now, something is better, could be buko juice or the coconut water. The person will feel stronger faster. But the one that is more powerful in terms of regaining electrolytes, vitamins, minerals, really quick and more effective is the vegetable broth. How do you do vegetable broth? This is the way you do vegetable broth. Vegetable broth, you get any kinds of green leaves like camote tops, sweet potato leaves. You can get saluyo, alogbate, pechay, even repolyo, any of the green leaves, Chinese malunggay, all of that. You don't have to have all. Even if you have only one, only camote tops, no problem. Only sweet potato leaves, you can do it. Get a big bunch, put it in the pot, 2 liters of water, 1 liter, whatever you decide, and then you boil it 20 minutes. You want that to be boiled well. Then when it's finished, you strain the liquid. You want the liquid. The fiber, you don't want it. You want the liquid. That broth, that liquid, you can put a little salt, maybe some calamansi, you can do that too. And that, the person, when it's cooled down, the person can drink it during the day as water. And then the person will start regaining the minerals and so on. If the person do not have problem with sugar like diabetes, if it's an emergency situation and the person is really weak, you can use a tablespoon or teaspoon of molasses in that vegetable broth or without the vegetable broth. Either way, it is very good for regaining the minerals back into the body. The person feels stronger. You can do another wet sheet pack if you need. Few hours maybe, or the next day you will be able to do it again, because the person loses electrolyte, loses vitamins and minerals, and will not be able to stand the treatment to fight the malaria parasite. But doing these little tricks, you can regain strength enough to keep fighting, and then you can keep going. Yes, in some cases, molasses. Now, let me tell you some of the other plants that you can use in case you want to add something else. And remember, you don't have to use them all. It's just options, because God has given us a lot of options. If you don't have one, you can use another one. What other plants are useful for malaria or some of these infections, especially parasitic infections? Mayana or Lampunaya is named Coleus for calling in the scientific name. It's a family of the Coleus. They are good for thyroid diseases, they are good for other things, but also for anemia, especially the purple ones, and diabetes even, but also for malaria. Oregano actually is part of this family, but they are not purple, they are in the green side. Golden seal. Golden seal is not found in the Philippines mostly, but if you have it, you can use it. Golden seal is very bitter, very expensive in the US. But we had the blessing that a friend sent me some golden seal from the US, and we had some, we used it. It is also good for malaria. But you don't have to lack. You have some other things like papaya seeds. You can use papaya leaf juice also. That's what I actually used when I had my amoebiasis type C when I was in 2017 infected with amoebiasis. I actually used papaya leaf juice, pure, 3/4 of a cup, plus 1 cup of buko juice to be able to stand it and not vomit. 3 times a day for 2 weeks. I did that so I will be able to recover from amoebiasis. Actually, my platelets went down to 20,000. Now, the normal is 150,000. 150 to 450, approximately that's the normal. 150,000 to 450,000, but mine was 20,000. So I was actually in a risk of bleeding out. My blood was not staying in my body, it was just going out through my pores, kind of. So I drank the papaya leaf juice, and in 3 days, my platelets went up to 341,000. So what a blessing. Of course, I did other things like Wechit Pack. My queen came from Mexico at that time. That's when I was able to do some more treatments. And in 3 days, I was basically coming back to normal. The next one is ampalaya seeds. You can use ampalaya seeds. And also periwinkle. Now remember, periwinkle is a very strong plant. It's compared in some scientific studies as chemotherapy or radiation. It's very strong. So you can drink only 1 to 2 cups a day. You don't drink more than 2 cups a day of periwinkle. And how many leaves? 7 leaves in 1 cup. 7 leaves of periwinkle in 1 cup, or 2 cups a day, that should be good enough, not more than that. It's not recommended to have so much of it. Okay, we went through that already. Other herbs. Another one is dill. You know dill? By the way, I have not been able to see the name of dill on Tagalog. Anybody knows? It's just dill. Okay, we leave it as dill. It's easier now. No problem, because I like to have the names so I can share with people other names. They can quickly get the names, but dill, no. But dill is very good. Dill is good for infection. It's good for depression, seizures. It's good for cooking the beans so they stay longer because it's antimicrobial, so the food will be preserved more. It's good for Sabbath preparation because if you cook the beans on Friday, be ready for Sabbath. You don't have to cook on the Sabbath day. They will be able to last longer. Even if you reheat the beans in the morning, Sabbath morning, you just reheat it, the beans will not get spoiled. I can assure you that. The only thing that makes the food spoil is your saliva. So don't taste the food with your spoon. Don't put back your spoon in the food. That's what spoils the food. If I have an opportunity, I will teach you more about preservation of food, but that's not for today. Anyway, we will see. Another one is sorrel. It's also good because of the vitamin C and some other elements. Lemongrass is also good. One of the best antiviral is lemongrass. Turmeric is also good, very good actually. Most of my cases in the Palawan region with natives, they don't have anything more than turmeric. But I put them in a no sugar setting, no sugar at all, because that's one of the problems in the mountains. Sugar is accessible, it's cheap, and they have that. Every house has sugar. So we put them off sugar, in few days they are recovered. With turmeric, of course, and that's very common in the mountains, so that's not a problem. Cumin, that's another one that is good. Clove is another one that is good for parasites. Cinnamon is another good for parasites. Oregano. Cashew leaves. Now, for the cashew leaves, because it's very strong, what you do is you just chew the leaf, get the juice in, you drink the juice, and throw the fiber away, because it's very pokey. Cashew leaves. Now, it's interesting because we started with the cashew leaves because you remember the lockdowns. My queen was doing dental patients every Monday in our house. And when we started noticing that my queen will start having sore throat at the end of the day, but then we will realize that it was the days when she was taking care of a dental patient with the vaccine. Then what she will do, because she prayed, Lord, what can we do? Because this is going on and over again. I see a patient with COVID vaccine and I'm having sore throat. Why? Anyway, things are going on about that. So we started praying, and she prayed, and the Lord impressed her to use the cashew leaves. So she started chewing on the cashew leaves, and next morning she will have no problem. So I recommend cashew leaf for sore throats nowadays, and it's working really nice. Many people have done it already, and they have good results. The only thing I recommend is don't eat the fiber, because it's very pokey. But but it's a good remedy. It's not candy. It's very strong. But you can do it. Pine needles is another one that is good, although pine needles is not found in the Philippines easily. But if you have it, do it. Use it. Pine needles is really good. Even in the Spirit of Prophecy, there are quotes where Ellen G. White says, pines are healing. Another quote she said, when clearing the land of some of the schools, do not cut the pines. Leave them as much as you can. Of course, if you need to clear for some gardening area, but the more you can keep them, the better it is. If I tell you about some of the research in Korea with pines, there is more white blood cells activity in 7 days having exercise in the pine area rather than in the cities. Anyway, pine needle has been considered also the key for COVID vaccine people. You can take pine needle trees to recover from some of the side effects of vaccination, according to some studies. In the Philippines, you don't have much pine needles, so the equivalent of pine needles in the Philippines is guava leaf tea. So keep in mind those things as you can, help other people. The other one is garlic. Definitely garlic is good for malaria also. And pumpkin seeds. Pumpkin seeds are good. Some of the fats is good. What else? Other things that are good is flaxseed, if you have them, chia seed, of course, and pineapple. It's very important, pineapple, for the malaria cases, especially when they are getting already some problems with the hemoglobin and getting pale and so on. Pineapple has some effect in the controlling of the coagulation cascade, so it will be very helpful for the malaria cases. Any other things that we can do? Liver support. Yes, liver is affected by the parasite, so we need to give some support to the liver. How? Very easy. Number one thing is onion slices over the liver area. Onion slices. Just slice onion, put them on the skin on the liver area, wrap it, and sleep with it. That's one of the easiest things for healing in any soft tissue of your body. You can do it in your ear, you can do it in your liver, pancreas for diabetes, you can do it in any other intestine, pelvic area for female issues. Very simple poultice, we will say, or tapal. Puso ng saging is the cheapest thing. If you don't have onions, you can use puso ng saging. The flower of the banana, just get a leaf. If it's too concave, it's too round, just, open it a little bit, It flattens really nice, and then you can put it on top of the skin. So you can sleep with it, and it will decrease the inflammation. In 2019, I was doing 3 hours wet sheet pack for my queen when she was having problems with her dental implant. I will talk more about that later. But one of the things that I use, because sometimes she will tell me, don't put cold water on my head. And I said, no, that's very important for you. But maybe she was not thinking well at that moment. Anyway, I did not put water on the head, and then she will get very hot. Then she will have this feeling of hotness in the brain even after the treatment. So what I will do is I will put pusunan on the head, and no more problem. So use it. Even if you have a fracture, if you have a skin, whatever you had in the body like that, you can use pusunan. It's the cheapest thing. Remember, one of the requirements for God's remedies is it's accessible to people. So if it's a natural remedy, it must be accessible. If it fits those categories, it is God's remedy. Okay? That's in Consistent Diets and Food, I think 302, where it talks about the definition of diseases and the remedies that God approves. Liver fermentations. Of course, you can do liver fermentation, 3 minutes hot, 30 seconds cold. 7 exchanges. You can do it once a day, and that will give support to the liver to make sure that the parasites are not affecting the liver too much. Charcoal drinks, yes, charcoal binds toxins, so that will help, number one. And number two, charcoal binds cholesterol molecules, especially bile. So if the liver is floated with bile and it's too much and there are problems with the fat digestion, charcoal will help the liver to rest from so much work and drive some of the toxins out. Castor oil packs. Castor oil is one of the thickest oils and is one of the most anti-inflammatory oils in the world. So one of the simplest things to do is get a pack of castor oil. Do you know castor oil? Ricino? You can plant it. Actually, I have plants in my home today, and I'm hoping that I can reproduce it. I saw along the way castor oil plants in here. So reproduce it. It's good for having oil in your, for balms, for salves, for, even just for inflammation, just massage. It's a good oil, castor oil. And you can use it for pelvic issues and other things. So it's very useful. Now let's see some of the tricks and wet sheet pack that I will recommend. Being in the mountain, you don't have electricity, what to do? You don't have ice water, no problem. You can still do it in the mountains, even though there is no ice, even though there is no electricity. The simplest thing is just use a fan, just hand fan, and somebody moves, and somebody comes tired, and somebody else helps. You just fan. In some cases, you can have, oops, sorry. My presentation is not running well for some reason. Sorry. I got frozen. Okay, let's see if we can go back to it. All right. As you can see there, I had a 12-volt fan, just a car fan. And we put it in the solar, in the solar system, and we just had it there. Another way is just to have an inverter from 12 volts to 220, and you can have that. It's easier. But if you don't have that, you can use your hand fan. That's easy. Another one, it is very key to have a container with water on the head of the person. Example for my daughter Kayla there, you can see I put like a palangana or something like that. You can use a plate also, like a bowl, but not too high, because then it will be very hard on the. And then the next trick that is very important is this. It will be good to elevate the chest of the person a little higher, so the water, when you pour water on the head, always run down, not back to the person's back. Because if the water goes to the person's back, then the person gets cooled down and the treatment is damaged. So by putting a pillow below, not too high, but something enough to increase the height of the chest of the person, then the head will be always lower a little bit, so the water will run down instead of the back of the person. So those are little things that we can use. The next thing is, for wet sheet pack, many people are not able to heat up when they are doing the treatment, and they get cooled down instead of heating up. For that, you have two things that you can do. Number one, do it in the sun. Take the person with a bamboo bed or something, put them in the sun with a shade on the face, and you can do it right in the sun. They will heat up right away. Let's say that you don't have the sun. What do? You can use hot water. You can put hot water bags on the feet of the person, or you can have hot towel on the person's body, just on top of the blankets maybe, and cover it again so the heat doesn't go away. But you can do that. The other way is this. You get ginger, you put it in the water, you can grate it if you want, put it in the water, make the tea. Maybe 1-2 liters, no problem, before the wet sheet pack treatment. You get 1 cup out of that tea, the person drinks the tea, and the rest of the water is where you're gonna put the wet sheet. You wet it with the ginger tea. When you wrap the person with the ginger tea, wow, they're gonna sweat. They're gonna get really hot really fast. So that's a trick that you can use. It will be very simple. Even if it's night, they will heat up. Or using some water too, but that's good. Yes. One more thing. To economize water, you know, in the mountains sometimes you have to running water. You run up and you come down. It's hard to get water. So what do? If you have a bamboo bed or mattress or something that is kind of holey, you know, you have holes in it, you can have a bucket below, and then you pour water on the top. The water comes down in the bucket. When this one is full, then the next one is empty, then you can just change and keep using the same water. As soon as it goes down, it cools down, so you have to worry. You can reuse the water, keep reusing the water, and you don't have to be looking for more water to do the treatment, especially if you are alone with the patient. So that's a very important point also when doing wet sheet pack. Remember also that if the person is passing out, laughing without reason, talking about something that you have not been talking about, you know the person is losing consciousness or maybe just getting too low in the sodium. Sodium low, called hyponatremia, makes the persons to feel confused, irritable, weak, extremely weak, and it will not be good. So you need to make sure that the person get back to normal. If that is the case, you can stop the treatment for a while, give them the vegetable broth, the calamansi juice, the buko juice, whatever. Make sure the person come back to normal. And if that is the case, you can also use the fetal position. You know what the fetal position is? Just bring the leg back to the body, you know, both of them too close together, the hands together, and if you can wrap it with water so it cools down the body, the brain gets more blood, and the person doesn't pass out. Okay? Very simple. And you finish the treatment because no need of continuing the treatment. You need to get the person back to normal. So now, talking about contraindications for wet sheet pack, it's very important to consider kidney failure patients. Why? Kidney failure patients do not control the balance of the electrolytes really well. The potassium goes too high, sodium goes too low, and the balance of the electrolytes is not well in a kidney failure case. So if a person has kidney failure, you have to be very careful because you may not be able to do wet sheet pack for these cases. It's better to rely on other treatments at the beginning for kidney failure. But if the person is able to stand it, they are strong enough, then you can do it. But if not, you have to bring the person back to strength before doing the wet sheet pack. The other person that may not be able to do wet sheet pack is the heart failure patients. Maybe they cannot do it because they don't have good blood circulation, and you have to consider that. Someone that has been having diarrhea, vomiting, the electrolytes are not well, you can also consider not to do wet sheet pack at the moment until the person recovers the electrolyte balance. All right. The next thing I want to share with you is this plant, Marasili, also called Hagunoi in some cases. I have seen some people spelling it with G-O, Hagunoi. Whatever form you know it, then scientific name is, I forgot. Closto something oredata. Anyway, you can find it online. It's online. You just put Hagunoi, you will find it. This plant is great. This plant has been used for what? Mosquito repellent and for hemorrhage. It is very good for hemorrhage. Very good for hemorrhage. But not only for that. It is an antimicrobial agent. So it doesn't matter what wound you have. If you have that plant and you squeeze the juice out and you put it in any wound, there will be no infection. I tested it with a very bad wound one day. It had worms. There was a hole there. You could see the bone. There was a lot of worms in there. So what I did is I put my gloves. I crushed the leaves, get a lot of juice, put it in. The worms doesn't like it. And then I put them all out. Took them all, the hole out. And then I packed it with more leaves with the juice in the hole. 7 days, that wound was completely healed, sealed, no more problem. No bleeding, no worms, no smell, clean. So, my friends, take advantage of this plant. Wherever you find it, don't cut them all. It's weed, so you don't have to worry about planting it. It's everywhere. You know it, right? But it is so good. Imagine, you can use it for cancer wounds. A cancer patient, there's a lot of smell, and those wounds, you get this, made a lot of juice and pour it there. There will be no smell, no infection, and the wounds will heal better. Okay, very simple. It's God's remedy. Now that only works on the wound, but that doesn't work with the cancer inside the body. But at least we have something to fight, in the outside for these patients. So you can use it in any wound. I have used it in circumcisions. I've used it in any wounds, at home, cutting with a knife, with the bolo, whatever. It's very good. It's very simple. Anyway, the next one, turmeric. Look, when we were in Tagumpay one day, my queen was having a dental extraction. It was one of the wisdom tooth, which is very difficult for extractions. It was getting late in the evening. This is a person coming from far from, mountainside. And she was helping the person, but he was bleeding a lot. Maybe he was drunk the day before, whatever the reason was, he was bleeding a lot. So my queen was praying, Lord, what can I do? I don't know what to do right now. So as she was praying, the Lord impressed turmeric powder. So she sent the children to the kitchen, bring me the turmeric powder. And she put 1 teaspoon of the turmeric powder in the tooth area. The blood coagulated right away. She was able to clean it. She was able to see exactly where the instrument should be. She took the tooth out, no more problem. As simple as that. Now, the other case was herself. 2019, as I told you, my queen was dying from a dental implant. We finally convinced the maxillofacial in Puerto to do the extraction because he makes implants and he puts implants in people, but he had never taken them out. He said they are perfect. They are good because they give a lot of money maybe. Dental implants are so expensive. Anyway, she requested the maxillofacial, please take that implant away because my queen had one dental implant on her. I will talk more about that later. But anyway, she took the dental implant out. But for the day of the extraction, we went to the city there in Puerto, and we took with us turmeric powder, and we also took the lidocaine, the anesthesia, without epinephrine, because my queen is allergic to epinephrine. So doing the extraction with lidocaine for anesthesia, but without the epinephrine, she was going to bleed a lot. So we knew that. So to prevent the problem, we took turmeric powder with us so he could use it, the maxillofacial. So we told him how to do it, and he said, okay, I will do it. He agreed. That's a blessing. Anyway, she definitely bled, and then I handed the turmeric to the doctor, and he put it, and no problem. He applied it, and no problem. No bleeding. The bleeding was stopped nicely. She had the extraction, and no problem. She is a new woman now since 2019. What a blessing. The next case that I will tell you is this. I had a cancer patient coming to my home one day there in Tagumpay. It's a cancer of the brain, facial cancer also. And it was developing masses coming through the maxillofacial area to the nose. And they were actually coming out of the nose and dropping off. And she passed two, one in my house and one in her house the next week that she left. But the thing is, after passing the mass, like a little ball like that, she will start bleeding because, it's attached to the inner parts and it's bleeding a lot. There's a lot of blood vessels in the area of the nose. So I will pack turmeric powder in a gauze and then introduce it and then keep it there for a few minutes and the blood stops. So it is very significant for stopping the blood from flowing. And then when she was home, she called me, Dr. Boutet, I passed another mass again through the nose. What should I do? Same thing. I just taught you how to do it. Just do it at home. No problem. So she did it. She put the turmeric powder into the gauze, put it there, kept it a few minutes, and no more bleeding. Sadly to say, she went to the hospital because of chemotherapy and radiation. She decided to do that. And when she was at the hospital, she had another bleeding, and she bled, and she bled, and she bled, and she bled. And she asked the doctor to have permission to put the turmeric, and the doctor refused. And she bled, and she bled, and she had to have 2 packs of transfusion. Sadly, because with a simple remedy, you could do it without any problem. But that was the case. They called me, but what can I do? I cannot do anything. Anyway, this is just examples so you could see how good God is with us, that He has given us what we need. The only problem is we have no knowledge. And I am very thankful that God has led us into these little things that could help people so much. Today, when I do surgeries like circumcision, one day I did 9 circumcisions in one day. My queen told me there are 3 men coming from the mountain to have circumcision. Oh yeah? Oh good. Okay, yeah, I can do it. 3 days, 3 in one day, it's okay. When I arrived to the church where I was going to do it in the pastoral house, 9 cases were there. Whoa, what am I going to do now? They are coming 3 hours from the mountain. I'm going to send them back? No. All right. No lunch today. Anyway, I started doing my surgeries. But all my surgeries, I do them with turmeric. So after of course, I use anesthesia. But after doing the surgery, when I do the stitches, I use turmeric. I wrap it around, keep it. Never had any infection, any problem with my patients. One day, one stitch was not so good, and the patient was bleeding. He was coming with a lot of blood in his pants. Came back, put more turmeric, put another stitch, and he went back home, but only that. But turmeric is very good for that. Doesn't go. Actually, what I do is I have the turmeric ready in the tray with the gauze with the turmeric, and when I finish the stitches that I clean and everything, then I just pour the turmeric around the stitches area on the cut, then wrap it with the gauze, then tape it well, and they go home. Never had any problem. Never. And I give them the instructions. Of course, I give them golden seal, charcoal, and turmeric in capsules, or powder only like that. Just drink 2 times in that day, one in that moment and another one in the evening. And normally with that, that's enough. They have no problem with pains. They can stand and they don't have to come back. What's turmeric? Luyan dilaw. Luyan dilaw. Kunit in some cases. Dulaw. Luyan dulaw. All right. Turmeric powder or fresh, either one is good. In an open wound, anything. You can pour turmeric in any wound. Doesn't matter, open, close, anything. Turmeric is an antimicrobial, so it will not create any infections or anything. Many people are afraid of putting things in the wound because they may cause infections. But in the case of hagunoy and turmeric, you will have no infections. It's antimicrobial, so it's not a problem. All right. Turmeric. Turmeric is one of the best things today for my cancer patients. The number one thing I use for metastatic cancers is turmeric in terms of herbs. I will talk more about that later, but this is about turmeric. So take advantage of turmeric. Plant turmeric in your place. It's very needed. Dehydrate, make some powder so it's ready when you need it, however form, but turmeric is really good for diseases. Many things you can use turmeric. Hemorrhage, anti-inflammatory. You know, I have very hard, injuries on myself. And we took turmeric, and that's good enough. For the cases of pain, especially with circumcisions, I tell them, take it every 3 hours. Don't wait until the pain comes. Just take it every 3 hours to make sure that the pain do not come. 1 day, 2 days, the pain will not come again. So after 1 or 2 days of taking it every 3 hours, you will not need to use it anymore often. So you can use it seldom, but not often. And sometimes even 1 day is enough. No more. Okay, cancer updates. Please, people do not need to die from cancer. It's not difficult. It is possible. But we need to be very simple. We need to be very strong also. Patients with cancer may die because they don't know. But I will teach you the tricks today. Please, no one needs to die from cancer. Okay? I don't force my patients to do what I say, and I don't want them to believe what I say. Everybody has to study and believe what you do. But this is simple. It is possible. You don't have to die from cancer. Okay, number one, I review with you the simplest thing. Cancer cells feed on sugar. It's the number one thing that makes cancer grow, sugar. So for the time of fighting a cancer, especially the beginning, and especially if the person has metastases, do not use any sugars. No agave nectar, no molasses, no honey, no sugar, none of those things. No fruits either. Fruits are very high in sugar. Now, some cancer patients have used fruits and they have no problem, but not all the cases. And if there is a very bad case and they are using fruits and it's affecting them, it's better not to do it, right? So focus more on the vegetable meals than on the fruit meals, especially at the beginning. Later, you should be able to go back, no problem. Like I had a case in 2019, cancer brain. The person is eating regular food right now. 2022, he had a relapse. The metastasis was coming again. Cancer was spreading, pains all over. And he started doing again what I told him. And today, he's working in the garden, eating regular vegetarian diet, no problem. Eating again the fruits and all that, no problem. So it is possible. The point is we have to just be strict for a little while until the body is able to heal. So sugar is the number one thing that feeds cancer. The second one is vegetable oils. So for the cancer patient, please, not a drop of vegetable oils, because that's the second main feeder for cancer. And number three is animal products, especially cow's milk. So please do not use cow milk, yogurt, cream, sauces, whatever. Even vegetarian cheeses. Why? The key for the cancer to turn off and on in China study by Dr. Campbell is casein or whey. Casein is the protein in the cow milk. Even if you isolate it, and in the US, when you isolate the casein out of the cow's milk, it's called vegan. Now they use it in the marketing and they put it in the vegan cheeses and they say vegan. It's vegan, but read the ingredients, it has casein. It's the same thing with vitamin D3 supplementation. We'll talk about that later. They can call it vegan because it is isolated, but that doesn't mean it's true. It's a lie. Anyway, you have to be careful. Okay, after eliminating all those things from the people's diet, there are some other things that we need to consider. What are those? Of course, this is what I recommend. If a person is having a really bad case, he's starting the treatment, he needs a boost to start well. 3 weeks, no fats. Of course, you are not using any oils because that's not good for the cancer. But for the start, I tell them 3 weeks, no fats. No avocado, no chia, none of that. Focus on your flavor, on calamansi, lemons, salt, herbs like oregano and things like that. Then the person will eliminate all the fats. This way, the metabolism of the body will go so low, that the person will have nothing to feed on the cancer. If the person is overweight, don't worry about losing weight. Why? Your fat will feed the cancer when you are not eating. So don't worry about losing weight. The only thing I will explain later is that you need to make sure you are getting strength. As long as you are getting strength, even though you are losing weight, no problem. But I will talk more about that. The next thing is turmeric. So let me tell you the case. 2019, I had a brain cancer case, pressure on the brain, not able to hear, hearing at tinnitus, the hearing of the voice there, noise in the ear, because of the pressure of the brain cancer, pushing already, softening the bones of the zygomatic, all these symptoms coming up. Then he started having pains on the arm, then the next week pains on the leg, pains on the liver, pains on the back, not able to sleep well because of the pain on the back. So metastasis is going on. The cancer is planting itself in other parts of the body. So at that time, 2019, around that time, I had come across a quote from the Spirit of Prophecy that I will share tomorrow with you as I talk tomorrow about last day health. But this is a very important quote, the Spirit of Prophecy, because it's the place where God has given us a number. Not only a recommendation of, be careful with fats. No, he gives us a number. So I will read it to you tomorrow as we talk more about that. But learning about that, I was meditating, praying to the Lord and said, Lord, what's the problem with this? We have overlooked this issue and we have not been careful with the amount of fats we eat. But God has a limit. He has a number. Anyway, I was thinking about this and I was thinking about my cancer cases. And I remember when I was at Hcbntv, if there is one thing, we need knowledge. And Dr. Agatha and I, we talked together many times at Hcbntv. And we were honest enough to say to ourselves, we are not having good success with cancer patients. Why? And we knelt down to pray, Dr. Agatha Drash and I, and we pray about it and we look for the information until, we found some other tricks. But I think 2019 is the time when God really revealed to me what the problem was. Fat consumption. Why? Think about this. If you have carbohydrates, fats, and proteins, those are the three that gives energy to the body. Now, from these three, carbs are 4 calories in 1 gram. Proteins are 4 calories in 1 gram also. But fats is 9 calories in 1 gram. So which one gives you more energy? Fats. So if you eat more fats, what will happen? Cancer has more calories to grow. All right, so if you reduce the fats, what happens? The cancer will not have enough to eat, so the cancer can die faster. Then after that, I said, you must eat a lot of turmeric. 2 to 3 fingers of turmeric every meal. 2 times a day, 2 meals a day. Cancer patients are better with 2 meals rather than 3. So I recommended 2 to 3 fingers of, the turmeric. You just peel the skin, you just wash it, and then just eat it in your meal. 2 times a day, no fats for 3 weeks. And the pains went away. No more problems. Of course, he was doing kale in the US, a lot of kale. Kale is one of those best cancer fighters. White radishes, garlic, very simple, and the cancer went away. He started working in the garden, no problem. The pains went away, the pressure went away, the hearing of the noise went away. No more softening, no more problems, no more pains. He was able to work, and no more problems. 2022, the same case. He started having pains all over the body, even at the back. So we knew that the pressure was coming back. Everything was back. Then I said, what's the problem? So the answer is avocado season. They're buying a lot of avocados, eating a lot of avocados. I said, well, maybe something is wrong. Anyway, whatever the reason is, you name it, cigarette around, whatever the cause is, really, fats may contribute to the problem. Not that they are the cause of it, but if you have too much fat in the diet, it is going to contribute. So I told him, okay, let's just review. And I told him again what to do. I recommended the same thing. Just keep the treatment as you do, but make sure you have no fats for the 3 weeks, and then start using turmeric again. And today the person is well, no problem, back to normal. You see the simplicity of this? All right. Garlic, white radishes, vegetable greens, green leafy vegetables is the key for that. No MSG. I'll tell you another story. I had 2 cases in the mountain, 2 indigenous people. 2 of them went into drinking, parties, drinking. One of them started having pain in the liver. Then they called me. I came, I checked his sugar, 237 or something like that. Sugar was high. I know the liver, the pancreas was involved. Maybe an infection of the liver, I don't know. So I told him about what to do for the liver support, onion slices, fomentations, all that. No fats to be able to get the liver back to normal. I can give you all those protocols if you need any time. Just contact me and I will share with you. Anyway, he was better. 3 months. Then I came to his house to see him. And I can see the mass. Really big. Not as today, but really big. So I started working with him, no fats, the same thing. And he started. He was doing better, he was doing better, he was doing better, he was doing better. He's not an Adventist. He's a smoker. He gave up smoking, but there's a lot of people smoking in his house. So it's not really out of it. Then I found out that he was having the cancer very hard. So I came to the house and I told him, let's review. So I reviewed with him, and when I asked him about MSG, he said, I use Maggi-Sarab. I said, okay, no more Maggi-Sarab. Maggi-Sarab is MSG, monosodium glutamate. And of course, we have to see the 40 different hidden names of MSG in the products that we eat. Like, for example, gelatin. Gelatin is MSG. Or maltodextrin, or nutritional yeast, or barley malt, or all of those things are monosodium glutamate. So if you are using any of that, the cancer will not go away. Okay, 1 week only, he stopped the Maggi-Sarab, and the week after, this cancer was soft. It was already, when he will touch it, he had no pain at that moment, and he was able to go to swim. So he was very happy. Today, his cancer is still big, but it's soft, and he goes to the farm to work. Because when you have cancer, you should not stop exercising. You should exercise as much as you can. If you cannot, then you cannot. But if you can, exercise. Exercise is good for cancer. Anyway, he goes to the mountain. He's a native. He just go to the mountain, to his rice field or whatever, and he works. I saw him the day that I was coming here. He was walking with the family to the farm. But I don't know how much he can go, doing the treatments and so on, because the temptations are really big, But at least it's a testimony of what I am talking about. See? no one should die from cancer. So what do you do if the cancer is already open, smelly, has wounds, and you want to treat that cancer? What do you do? Hagunoi, turmeric, yes, or even essential oils. Essential oils are very good for taking away smells of rotten things. It has been used for many years for preservation in embalming, you know. So it is good for cancer patients. There are other treatments that I am developing right now that maybe we can share more later. For example, wood ashes. Just straining all the wood ashes as soon as you get it done. You strain it and just put it on the skin of the wound. You know, cancer, you know, very smelly, putrefactive. Just put the wood ashes. Now it's going to bleed. Be aware. Wood ashes will destroy all those bad tissues and it will bleed because it's all raw. But once it bleeds, you put hagunoi or turmeric. No more bleeding, no more problems. It will heal nice. If you don't have hagunoi, you can have honey. Pure honey, make sure it's not wet. Pure honey does not allow bacteria, viruses, and fungus to grow. So when you have it in a wound that is open and you want to heal it, close it, and make sure there's no infection, honey is a good way to go. In the US at Hcbntv, when I was doing surgery, I had a container of honey, pure honey, a very good honey, for 4 years. And that's what I used for surgeries. I did not use any antibiotic creams on all my surgeries. After surgery, stitches, honey, gauze, 3 days, no infection. Never. Zero infection on all my surgeries. So, if you don't have hagunoi, honey is an option. But hagunoi is simpler. You don't have to buy it. And you don't have to waste it. You can eat it. All right. Weight management. Okay. This is like an example of cancer. I was in Tagumpay and somebody came to me saying, I have a cousin or something, she has cancer of the uterus, myomas. She doesn't want to take it away, she doesn't want surgery, but she wants to do it naturally. What to do? Okay, I went to her house. I told her how to do wetched pack. I taught the family how to do wetched pack. I took 3 hours because normally it takes me 3 hours to teach them everything about cancer. And then I went home and she started doing it. She came one day to my place walking. Oh, I said, wow, she was losing weight. But then, because they were concerned, can she eat rice now? Yeah, she can eat some rice now. She has been so long with absence of rice. Anyway, she was strong enough. She walked up, and then I asked her, are you strong enough? She said, yes, I'm working in the garden. Oh, you're working in the garden? Yes. She was walking to my place. So she was strong enough, and the cancer mass, the myoma, was smaller and smaller and smaller. So, key, if the person is losing weight, is getting weak, and the cancer is getting big, the cancer is killing the person. But if the person is losing weight, but the person is getting stronger, and the cancer is getting smaller, the person is fighting the cancer. Okay? Simple. You don't have to die from cancer. You don't have to worry about your weight because your fat will feed the cancer sometimes. So it's not a problem to lose the weight as long as you're getting stronger, you can perform, and the cancer is getting smaller. No metastatic pains and things like that. So hopefully that will answer the problem about cancer management.